Good afternoon, everyone. Today is April 9th, 2025, and it is 1:04 p.m. As a quorum of the committee is in attendance, I'd like to call to order the meeting of the Central Health Infrastructure Committee. As a reminder, a committee member may also be participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. My understanding is we don't have anybody signed up for public communication, so we'll go straight to the agenda. Number 1, review and approve the minutes of the January 15th, 2025 Infrastructure Committee meeting. Do we have a motion?
I move the committee approve the minutes of the January 15th, 2025 Infrastructure Committee meeting.
We have a motion to approve. Second from Manager Jones. All in favor? Aye. So the next item is item 2, discussing and taking appropriate action on Central Health owned or occupied real property and potential property for acquisition, lease, or development in Travis County, including next steps in the redevelopment of Central Health downtown campus, administrative offices of Central Health Enterprise Partners, new developments in eastern Travis County, and possible settlements related to condemnation of Central Health properties by governmental entities. I announced that the committee is convening and closing.
Manager, I apologize for interrupting. We do have a short open presentation on this before.
Oh,
close,
forgive me. Thanks.
My apologies for not sticking that in there in your script. So Stephanie's going to handle that.
Stephanie McDonald, I'm sorry. I forgot. I neglected to mention that we had a brief introduction presentation here with Stephanie.
Well, this is actually just an update on our capital program. And Brianna, if you don't mind going to the next slide, there we go. I just want to let you know that we're really excited. We have received our permit for this from the City of Austin for the interior of Hancock. This puts us right on track. And we are about 80% complete of the design of Colony Park. I think we've shown you some of the preliminary massing and floor plans. We'll come back when those get firmed up. We are also planning to go to the community and show our work and progress there. We have made some progress on the CEC medical respite. We have done interior demolition. We are waiting for a permit from the City of Austin to finish out that interior renovation work. And we are also well underway in doing an interior demolition at Cameron Center. And we hope to have learnings from our CEC medical respite program that will help us influence the design of that overall Cameron campus. Next slide for me, please. Thank you. This is just an update to that development timeline. Nothing really to report. We did move off Del Valley, and I do want to let you know that we are very excited. I think we have bumped up the grand opening event to June the 7th, so stay tuned. And with that, I'd like to ask that we go into closed session.
Right, and before we go into closed session, just want to reiterate that the grand opening is June 7th for Del Valley. Excellent, excellent news. I announced that the committee is convening in closed session to discuss agenda item 2 under Texas Government Code 551.071, consultation with attorney, and Texas Government Code 551.072, deliberation regarding real property. The date is April 9th.
Recording in progress.
And the time is 1:08 p.m. It is April 9th, the time is 1:19, and we are returning to open session on agenda item number 2. Do we have a motion? Vice Chair Brinson?
Yes, I move that the committee recommend that the board accept the settlement offer from TxDOT for the property discussed in closed session, subject to final approval from the Travis County Commissioners Court.
We have a motion. Do we have a second?
Am I able to?
From
No, if I was a member of the committee. Dr.
so a
Martin?
second from Manager Valadez or
Yes,
from
Dr. Martin, I think. I have a comment just before.
and discussion?
Just very quickly, just one comment, and that is that I just wanted to make sure that we are exercising due diligence and communicating and working with, community care and the other enterprise members that may be impacted, whose patients may be impacted by any construction or activity at the Hancock and any other site prior to action being taken. Thank you.
Thank you, Manager Valdez. Noted. Appreciate it. All in favor? Aye. Any opposed? Abstentions? Motion carries unanimously. And lastly, I just wanted to give a quick update for awareness, and staff's going to be bringing a future agenda item to the regular board or the infrastructure committee as appropriate. At the February meeting of the Strategic Planning Committee, Dr. Lee and Jeffrey Richardson, the CEO at Integral Care, gave an update regarding the Mental Health Diversion Steering Committee and other communications with the city and county regarding a collaborative approach to behavioral health community planning efforts and potential use of the land on the Ash campus. Chair Kitchen and I have asked staff to give a more robust update on the status of these discussions. But the reason I'm bringing this up is because obviously there's going to be a future agenda item coming on it. And the city and county have filed related legislation and corresponding budget riders allowing them to lease land on the Ash campus from the state of Texas. Staff relayed this information to Ann and I recently, and we wanted to bring this to your attention. The bill numbers are SB 2719 by Senator Perry, HB 5141 by Rep. Howard, and SB 2720 by Senator Perry / HB 5142 by Rep. Howard. The next agenda item is to confirm the next Infrastructure Committee meeting date, time, and location. Our next, we're not posted for discussion on that. That was related to an upcoming agenda item.
Yeah, I was just trying to find an update on the Cameron Road campus. Where are we with that?
We're still in agenda item number 2, so I think we can do that. Thank you, Manager Jones.
I actually put this in the slide in the presentation that's in your backup. We are doing interior demolition right now in the campus of the 3 buildings.
Okay. All right, thank you.
Thank you, Manager Jones. Now on to agenda item number 3, which is confirming the next meeting date, time, and location. Our next Infrastructure Committee is tentatively scheduled on Wednesday, June 11th at 1 p.m. here at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas 78702. At this time, I'm ready to accept a motion for adjournment. Vice Chair Brinson moves adjournment. Dr. Martin seconds. All in favor? Aye. We're adjourned.
Good afternoon. Today is April 9th, 2025.
Mike, Dr. Brinson.
Good afternoon. Today is April 9th, 2025, and it is 1:25 p.m. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Strategic Planning Committee. As a reminder, a committee member may also be participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. We will now proceed to the committee agenda. Number 1, review and approve the minutes of the March 12th, 2025 Strategic Planning Committee meeting. Do I have a movement? Manager Valadez?
I move approval of the minutes for the March 12th Strategic Planning Committee meeting.
Thank you. And a second? Manager
Second.
Maflani? Yes. Thank you. Number 2, receive. Oh, I'm sorry. Discussion? Any discussion?
I'd just like to raise the possibility of, and perhaps it's me, but after all of these meetings, I have all of the minutes and all of the meetings and all of the paper. Is it conceivable that we could look at purchasing laptops for board members that could be used here, they wouldn't have to leave here, to be able to go through this? Because environmentally, this is just a waste, I think, of things. So are there other methods we could consider other than the paper?
We've done that in the past. We were all assigned computers, and some people had their own, and I guess it may not have been worth the effort, but that changed. So we're no longer doing that, but I think that's a good idea. It's just up to the board.
Now, because it's an agenda item to adopt them, and, I mean, when I leave here every day, I have tons of paper that I have to dispose of. So perhaps we could ask the infrastructure committee, or, well, not infrastructure, but a subcommittee to look at cost and come back with a recommendation.
We can look into that. I know in the past, as Manager Valadez mentioned, we've had iPads, I think, for board managers. I'm not sure why we stopped that practice, but we can do a little bit of digging and come back with a proposal.
And also another.
Thank you.
Oops, sorry. You were next. My apologies. No, sir. Thank you, appreciate it. I was just gonna suggest, and if we do some paper, maybe we don't print the same stuff over and over again, like the Central Health agreed upon, shared commitments over and over again, because it's in every single batch of paper, maybe just one time, and the same thing goes for the racial and social justice framework stuff. I know it's important, but that being said, we don't have to have 5 or 3 copies at every meeting. At a minimum, we can maybe start that way, figure out a way that we can streamline the paper that comes forward when it does come forward.
Manager Matwani?
I think at this point I'm belaboring it. I was just thinking the notion of some iPads that we could just check in and check out that would be preloaded, you know, might solve for this, but without going too much deeper into that.
The caveat that we be able to have documents sent to our personal computers for stuff we need to review at home, for example, that we don't have time to do. I'm fine, that's a great idea, Shannon, but I think that some things we do, I mean, I come and read some of the stuff we go over, because I have time to read it before I come here, so.
Just to follow up, but that would be, of course, Dr. Martin, that would be in keeping with the notice requirements and compliance with that. Thank you.
Thank you,
If we
Perla.
could get all our documents by the time we get notice on Friday, I would love to see that happen. But as of yet, I have yet to see it happen. But that's always a good thing for us to aspire to. Thank you.
Yes, yes. And Perla, thank you for volunteering to look into that. That's great. All right. So, oh, we need a vote. Okay, so. Yeah, so back to the minutes, yes. And do we have a vote for acceptance of the minutes?
Aye.
Yes, aye. Aye, thank you. Okay, number 2, receive an update on the Central Health President and CEO's fiscal year 2024 annual report. J.P. Eichmiller and Justine Price will be presenting.
Good afternoon. It is my pleasure today to present to y'all the 2024 Central Health Annual Report. At the conclusion of this brief presentation, we will be distributing copies of this to y'all. We can answer any questions you might have. It's also my pleasure to present our new demographics and statistics reporting analyst, Justine Price. She started a couple months ago, and she's jumped right into the fire and really helped lead the effort of producing this report. Next slide. So this report really reflects kind of a new creative and storytelling vision for what we wanted to produce for this board and for the public. Next slide. And next slide, please. And while our previous reports were informative, we felt that the impact could be improved. And we felt that we could tell a more compelling story and really bring the focus back to what matters, the communities and the patients we serve. You'll see this shift reflected in the many photos, quotes, stories, and web links that weave throughout the report, all guiding the reader through a continuum of care. Next slide. So this report is really focused and built upon our strategic priorities. These priorities are being developed with collaboration between staff and the board. Then it shifts into tracking how those priorities progress throughout the year, and it culminates with the release of this report, which communicates how we were successful in undertaking those initiatives. Next slide. So with that, I'm going to hand it to Justine, and she's going to walk you through some of these highlights that we brought forward in the report this year.
Thank you, JP, and thank you, Board. So the annual report is not just a legal document, but it's a chance to celebrate and showcase the progress that we've made towards fulfilling our mission. And the bulk of this report this year consists of these types of success stories. Next slide, please. So beginning with specialty care, in 2024, Central Health added 16 new specialty service lines, including diagnostics, at 3 new locations, at East Austin, Capitol Plaza, and Rosewood, Zaragoza. In this first full year of service, our direct care clinics logged over 6,000 encounters for patients for over 2,000 unique patients. The 5 service lines that appear on this slide are gastroenterology, podiatry, pulmonology, dietitian services, and nephrology had the highest numbers of encounters. But I think what's striking is that it just shows some of the diversity of the service lines that we're bringing to people who have needed these services desperately in Central Texas for years now. Next slide, please. Medical respite care expansion was also a major operational focus in 2024. We had 25 respite beds last year and plan to expand that to 50 beds this year. As of 2024, our respite services helped 197 unique patients receive this crucial care to support their healthy recovery. These patients are unhoused and often the sickest of the sick. And what I mean by that is that they have complicated illness, complex conditions, severe illness, a lot of comorbidities, vulnerabilities that makes their care more intensive and hands-on and require more oversight. Without these vital respite services, they would be forced to recover on the streets, which, as you can imagine, results in much poorer health outcomes, rehospitalization, and puts a strain on the system. So this is really critical care that we're bringing to these people who need it. Next slide, please. In the report, we also emphasize the importance of strategic community partnerships when it comes to addressing homelessness and closing gaps in the care continuum. The Permanent Supportive Housing Healthcare Collaborative comprises nearly 20 community-based organizations, including Ending Community Homelessness Coalition and Integral Care, our local mental health authority. And the Central Health System provides care through the Community Care Street Medicine Team, Transitions of Care, Bridge Services, and Medical Respite, in addition to things like contracting rooming services for the unhoused. I think the big highlight on this slide here is that over 11,000 people experiencing homelessness were enrolled in Central Health plans in 2024. And this is substantial. I mean, it's not a small number. That's over 6% of our patient population. Next slide, please. Central Health is building a better care system, and that also entails building trust among our team members and strengthening workforce development and advocacy. In 2024, we shifted focus to more of a lean operational mindset, trained 24 certified medical assistants, and dramatically increased services across the board, as reflected in the previous specialty services slide, as well as the by the number slide that we'll go over toward the end of this presentation. The medical assistant apprenticeship program, which is highlighted on this slide, was incredibly successful in its first year with a graduation rate of over 90%. This program might serve as a model for training other critical positions across the Central Health system. Next slide, please. Last year marked the 20th anniversary of Central Health, and it was also the year that our collective Central Health system united under one brand. This rebranding is not only symbolic, it helps to clarify the real relationship between our organizations, Community Care, Sendero Health Plans, and Central Health. And importantly, it reinforces our shared mission of providing accessible, inclusive, and integrated care to those who need us most. This rebranding also extends to our operational focus as Central Health and Sendero move from third-party administration of claims to in-house administration, while Sendero more than tripled its enrollments over the previous year. Community Care began providing services at the new Central Health Hornsby Bend Health and Wellness Center, and the Central Health System also performed a pay scale study and realignment to foster a continuing commitment to equity across the Central Health System for all team members. Next slide, please. Pursuing our mission of providing care for those who need it most, Central Health launched new specialty care service lines in June of 2024 in collaboration with the Travis County Sheriff's Office. This program, called Justice Involved Health, provides services to Travis County inmates to provide better outcomes for the incarcerated population. And inmates are also helped with things like enrollment in MAP and MAP basic plans. And I really like the quote on this slide from Dr. Vessel about how we don't just rehabilitate patients, it's about improving their lives too. And I think an important point to remember is that the vast majority of people in the Travis County Jail are not convicted of any crimes. They're incarcerated pre-trial, waiting for trial. Next slide, please. Improving health outcomes for the safety net population is not an isolated endeavor. This is not something we can do alone. It truly takes a village. Central Health works with many essential community partners, and in 2024 we continued to build on those relationships with organizations like the African American Youth Harvest Foundation, the Black Men's Health Clinic, the Trauma Recovery Center, and the Health Alliance for Austin Musicians, just to name a few of those partners. These partners help enroll individuals into Central Health plans and direct them towards our services. They also offer their own wraparound services to address health and wellness in a comprehensive way, further reducing gaps in the continuum of care. Thanks to strong leadership and the unanimous approval of the FY25 Central Health budget by the Travis County Commissioners Court, we can continue to close gaps, strengthen partnerships, and provide care to those who need it most going forward. And I just want to take a brief moment and kind of speak from the heart on this. I think that's a really special thing in Travis County. And one of the things that personally drew me to work at Central Health is that unity between elected officials and community partners and leadership here in addressing the health for the people who need it in our communities. I think that's very unique and is not something you see in all jurisdictions or service areas, and something we should be really grateful for in Travis County. Next slide, please. Now, the numbers really tell sort of the bottom line of our story here. Next slide, please. And that story is one of substantial service growth in 2024. Central Health is rapidly expanding to meet the needs of our communities and is doing so both strategically and collaboratively, moving in concert with our partners to close gaps in that continuum of care for our safety net population. I mean, these numbers speak for themselves. Over 171,000 people served in 2024, over 677,000 care visits provided, and a network that now has 255 provider locations. Next slide, please. It's not just that services are really growing, but the rate of that growth is also accelerating. In almost every case by 2 to 4 times the growth of the previous year. If you look at the 2023 service report, that year over year from 2022 to 2023, there's a lot of 2% increases, 5% increases. Here we're seeing almost double digits across the board, over 10% in terms of patients and visits. almost 13% in MAP enrollment, 20% in MAP B enrollment, 30% in CHAP. And I think this really, the takeaway here is that this really speaks to the intent and decisiveness in which we move to address community care needs. And with that, I'm going to hand it back to JP to talk about where we're going in the future.
Thanks, Justine. Next slide, please. So to conclude this report, we wanted to give a little bit of a peek as to what's coming in 2025. If you look through this list, you'll notice that we've already accomplished or met several of these milestones. This includes the opening of our Del Valley Health and Wellness Center and the expansion of partnerships in our continuity of care. Still to come are the completion of additional care sites at Cameron Road and Colony Park, as well as our Administration Health Center at Hancock. And the corresponding spread within the report expands upon this abbreviated list. Next slide. Finally, I would just like to briefly acknowledge all the team members throughout the organization that contributed to the development of this report. We had a wonderful collaboration. This represents kind of the finest that we can, some of the finest work we can do working as an enterprise and as a central health team. This includes folks from our communications, from our data and analytics, joint tech, the CEO's office, and many more. So thank you to everyone who helped. And with that, I would like to present you all with the actual report and be happy to answer any questions you might have.
And just as we're wrapping up, I want to add my thank yous. This is, if not the most important document we produce each year, it is one of the most important documents we produce each year. And I've just really appreciated the thoughtfulness, the flexibility, the creativity, and the humanity with which the team has really approached this challenge. It speaks to the heart. It also speaks to the numbers. It speaks to the growth. For me, it's a beautiful and moving document. And Justine, I appreciate you speaking from the heart in your presentation as well. I think it just reminds me of the caliber of the people that we have who choose to join us and do this work, and it means a lot. And I'm so glad you're with us, and you too, JP. Yeah, but I just wanted to, you joined us, hit the ground running, Justine. You had a lot of value, and it's a beautiful body of work. Thank you.
Any questions or comments? Manager Jones?
Yes, thanks very much. This is very helpful and very informative. If you go to your chart on our patients and numbers, I'm just wondering, is there any way we're able to ascertain within a calendar year, or a fiscal year, how many of these clients are in and out of eligibility that we're providing services for? The turnover a bit, or they're all the whole time all within their eligibility range. Just try, because with the changing demographics, the changing economic situation, particularly what we might be seeing in the next year under the current federal administration, the question of how many of these folks are going to be coming in that have historically not been part of our system, and are we able to track those, see where they are, what part of the county they're in, and then look at strategies to address those?
So the short answer is yes. We can track that churn from when people are coming into and out of the system. Kit Abney-Spelse would be our subject matter expert on how they do that through enrollment, but I can't speak from the data that I've worked with on the demographic report that we are tracking not only when people come in and out, but where they move to and from. If they are new members, if they have disappeared for a while and then shown back up. And we've been collecting this data for about 6 years now. We didn't used to have these capabilities. So we're starting to be able to identify patterns of that movement.
Have you seen any trends over those 6 years of what may have been going on in terms of where people are coming in and out of?
Well, we don't know exactly when people show up for the first time, where they're coming from geographically, and if they leave the county, they don't have to tell us where they're going. We just know we can see trends over time of people moving to different locations throughout the Travis County. We have seen, obviously, that I-35 corridor remains the kind of the living spine of where our patient population lives. But of course, we've seen diversity pop up in other areas of the county. I think we spoke a little bit about that last month. Really, our population tends to reside in low-income, multifamily housing and manufacturing housing communities throughout the county.
Comment is that what I'm seeing in terms of the demographics of particularly the eastern part of the county is that those changing social economic conditions are also being impacted with the growth that is occurring out there. And so population is being pushed further out, which means they may not be eligible for MAP. And so is there a reduction as a result of being pushed into Bastrop County or some other locations that we're seeing?
Not in MAP enrollment. We have been steadily, and last year, as Justine's noticed, steeply rebounding from the pandemic numbers. There could be factors, obviously the end of some of the Medicaid eligibility could have played a part in that, but overall, MAP Basic continue to increase.
Thank you.
Thank you for the good work. I had a question about the training program with medical assistants. Do you have any demographic data as to how many of them stay and work in Central Health? There's any sort of agreement about that, about how long they should stay with us if we train them?
I'll defer to our CMO, Dr. Ellen Schulte.
No, I'm good, thank you. Good afternoon, managers. Great question. I think we have hired 10 or 11, and CUC has hired 7. We've also connected directly with Peoples and with Lone Star to their HR to try to keep folks kind of within the FQ system.
Is there any sort of agreement that's done before we enroll them to train them, or no?
No, and we had, sorry, can I sit for 2 seconds? Yeah. Promise not to take up your seat very long. We had actually scheduled an additional cohort, and based on the fact that there are some folks that are not being kept within the system, and I think we're trying to keep up as to where they are hired. We needed to slow down a little bit. ACC is funding their didactic education. We're funding their externship education, so they have free access to education, but we didn't feel like we could guarantee kind of the end point. We're trying to link them as much as possible, but
I just was thinking as we try to expand that program to RNs, LVNs, et cetera, that sort of,
We have a nurse intern or a nurse residency that is up and running now, and a CHW program that we're prepping for the end of this fiscal year.
Okay, thank you.
Thank you, sir.
There's fantastic.
I wanted to thank you all for this work, and I wanted to especially thank Shannon for bringing up those very important points. And what I didn't hear, maybe it was just my prehistoric hearing capacity, but I didn't hear that we are tracking and seeing whether or not there are trends with respect to where they're coming from. We are asking where they're coming from. We are continuing to follow that information. It's almost like when you're advocating in the schools for making sure that we have a high graduation rate. Well, we want to make sure we have a high quality of health for our Travis County patients and population. And we can't do that if we don't know. So we want to diminish or decrease, that's part of the closing the disparity gaps. Making sure that we know where they're coming from, where they're going, so that we can properly prepare and include those strategies in our the development of our strategic plan. So we are doing that, correct? Because
To
I
the-
didn't,
we're
I,
doing
it
that to
kind
the
of started
extent
off,
we
it's-
can.
it appeared as if we started off a little bit wobbly. And I just wanted to make sure that we're not wobbly.
I think we're doing it to the extent we can. If
And what does
if
that mean?
enrollees choose not to enroll again, we can't.
No, I understand, but knowing where they come from, and if they choose not to, it could be because they're leaving, but they should be able to tell us, like an exit exam, you know, and since in MAP, we only have we're only looking at a 6-month period of time anyway. You know, that's still dealing with a finite amount of people, dropping off in the system and with the ability to communicate, especially since we're so into the digital communication, be able to access that, and they should have at least one visit with their provider. So I just want to make sure we can try to firm up a practice or a process to make sure that we can capture all that information, that data. And I liked the way that you had told us on another issue, just when you were giving us the numbers. I'd like to see personally the number of providers. So I have the numbers, and this is the number of providers, and I can kind of have a feel for how many people are being seen by that provider or within that cohort, within that discipline. I'd like to also have that. I think that you can capture that. And again, I just wanted to thank you all for doing this. And last comment, I think the spine that was created along 35 was done so on purpose. That was a dividing line between East and West, rich and poor, have and have-nots. And what we're trying to do is eliminate that spine so that we don't want to reinforce that. So anything we can do to make sure that that happens we would be doing a justice to our population. Thank you.
I just have one comment related to Manager Valadez, that I don't know if this is possible, but I think the idea of an exit interview, it's difficult to get, I'm sure some people, but I think it provides some valuable information as to why people, did they become employed, did they get private insurance, did they move out of county? I think it'd be some important data, in a way to measure our success or not success, really, and the affordability of the county, et cetera. So one more task. So thank y'all.
Manager Motwani.
Definitely appreciate this product. I also have seen a marked, over the past really year and a half, 2 years, just improvement in how our team communicates efforts and outcomes to us. It's really clean and distilled. Things as simple as just a nicely contrasted, large fonted, number display with clear call-outs on percentage increases, particularly as related to the MAP population. So that, and this is just a very polished product in general. Thank you for that. I think it's extremely salient and communicates quite a bit. In addition to, of course, statutory requirements as related to an annual report, it goes that much further in, I think, demonstrating our excellence. And that also being said, in relation to the numbers, the churn, I'm interested in the patient journey as related to churn, especially those who may churn out and churn back in. And I understand that, of course, the challenges that have been established in collecting that data. I just wanted to voice again that's also of interest to me. Thank you so much.
All right. So we will move forward. So thank you all very much. It's great.
Thank you.
All right. So item number 3, receive and discuss a presentation regarding fiscal year 2026 proposed driving forces. I announce that the committee is convening in closed session to discuss agenda item 3 under Texas Government Code 551071, consultation with attorney, and under Texas Government Code 551085, governing board of certain providers of healthcare services. So we are leaving open session. It's 1:54 on April the 9th, 2025. Today is April the 9th, 2025, and the time is 2:40 p.m. We are moving out of closed session back into open session. Our last item, number 4, confirm the next strategic planning committee meeting date, time, and location. Managers, our next Central Health Strategic Planning Committee meeting is tentatively scheduled on Wednesday, May the 14th, 2025 at 1 p.m. at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. At this time, I am ready to accept a motion for adjournment. Manager Valadez, and a second. Manager Jones, and everyone vote.
Aye.
Aye. Okay. Okay, thank you.
Okay, managers, we're gonna take a short break. We will start the Board of Managers meeting at 3 o'clock, so that gives us about 15 minutes. So don't stray, we will start then for sure.
I'm here.
Okay, there's Guy, and is Maram on?
Yes, I am.
Okay. David, you can go ahead and pass those out. You already did, okay. All right. So let's see, where's my script here? Good afternoon. Today is April 9th, 2025, and it is 3:08. As a quorum of the board is in attendance, I'd like to call to order the meeting of the Central Health Board of Managers. Managers, we're going to proceed to the consent agenda first. May I have a motion to approve the consent agenda? A motion from Manager Valadez to approve consent agenda items C1 and C2. Second from Manager May. All in favor? Aye. It's approved. Is Maram, are you on? There's an aye from Maram also. Okay, we'll now proceed to the regular agenda. Managers, we're going to take item number 1 in open session, and then we're going to go into closed session and take 2 and 3. So, and we'll take them out of order. We'll take the cancer initiative first, which is number 3, and then we'll move to the organizational chart as the second one. Okay, so item number 1 is receive a briefing and take appropriate action on the process for the selection of a new CUC CEO. Members, you have in front of you, and Maram, we emailed it to you. And Guy, I think it's come to you also, and we've shared it with your folks here. We have a memorandum of understanding with an attachment, Exhibit A, that's been agreed to by the CUC representatives of their board, as well as our representatives, Elisa May and Dr. Brinson and myself, and we've been working with our staff, with Dr. Lee and our attorneys and staff. What this does is it responds to a resolution that we received from the CUC board, where the CUC board, let us know that they'd like to proceed with with an internal search for their their next CUC CEO, but they wanted assurances on 3 items. We have done that. We've given them assurances on the 3 items that you'll see in the MOU in front of you. One of those items relates to a process that will go into our personnel policies, and that's Exhibit A. So the process and that's a process for the steps to take if there's a situation that involves the need for disciplinary action that the grantee is aware of and needs to notify the CUC board. So that's what that is. Now that is a personnel policy that will have to come back to us in the form of a personnel policy. This MOU says that we're agreeing with CUC that we're going to put this into a personnel policy. So it will come back to us on April 23rd in the form of a personnel policy for us to give final approval to. As part of our personnel processes, that's Jeannie Burton is preparing that. She's our HR director. She will run it through her processes, which includes her running it through her employment law attorneys, and then it will come back to us and on the 23rd, and that's the point at which we will we'll have it in front of us to give final approval to that. At this point, what we're saying here is that Exhibit A is what we're putting into that personnel policy. So, I'm looking for a motion to approve this.
Exhibit A, right?
No, to approve the MOU, which has Exhibit A as attachment.
Oh, okay. I so move that we approve the memorandum of understanding and with the attachment of Exhibit A, which will notate the personnel policies and procedures.
Okay, motion from Manager May, a second from Manager Brinson. Any questions? Yes?
We are in executive session, correct?
No, we are in public session.
Okay. Then I have a question about, how section 3 does not contradict with section 1. When the word selected supervisor dismissed by the community care board. How does section 3 not contradict section 1 when in section 1, the community care CEO will be selected, supervised, and dismissed by the community care board, and then in section 3, it states that if there is a need for the community care CEO to require termination or discipline, that the leadership will involve the managers. That's not saying,
Yeah.
involvement is vague. It's not specific enough for me.
Okay,
And not only
take a
that,
look.
but what about the community cares board before we get it?
Okay, take a look at Exhibit A. Exhibit
I
A,
haven't-
yeah, Exhibit A answers the questions that you've just raised.
Okay.
And if you look at B in particular, it talks about the steps. Those steps include notification to
Their board?
the board, the CUC board, as well as the Central Health Board, okay? So,
I have a question, then I guess just clarify for me, if you don't mind, Madam Chair.
sure,
So in this process, who gets it first? If the community care board gets it first, then they make a recommendation that goes to Central Health, and then we see that and take action, or it's an agreed upon by both? I mean,
it's concurrently.
process.
It's concurrently. So it says in B little I that the grantee, which is Central Health, notifies the co-applicant board chairperson at the same time the grantee notifies our board chair. Okay? So our board gets notification at the same time that the CUC board gets notification. Does that answer your question?
Well, I'm still, I just got this, so I didn't have a chance to
Sure.
read it, so in my head, I'm trying to work through the process, because as far as I'm concerned, they should be making a recommendation to us.
Yeah, this is just, what
And I
this
just want to make sure that that's clarified in the process.
okay, well, why
That's
don't I
all.
walk you through the steps?
Thank you.
That would help folks if we walk you through the steps.
Yes. I just don't want, I want to make sure that we're both protected, the community care board is protected.
Yes.
And that we're protected, but that we have a very clear understanding that we were not going to be repeating history, that's all.
I think that's the purpose.
Okay?
I think that's the purpose to clarify, and for further clarification, these work steps pick up
We're developed.
by CUC and shared with us, and so let me walk you through the steps. The first step talks about, and this applies, this is under B, this is the process if the grantee raises concerns, okay, regarding the behavior or performance of the co-applicant CEO. So if that was to occur, then these steps, little I through 6, is the steps that would occur, okay? The first step is notification, where the grantee, the grantee's us, Central Health, would notify the co-applicant board chairperson in writing about the concerns. And if the grantee's administration has not already notified our board chair, they will do so at the same time. So we both have notice. Step number 2 just clarifies that the written notice, it says what the written notice has to include. You know, and it's the concerns, any personnel policies that grantee believes was or may have been violated, and any proposed disciplinary action. If it's applicable, it may not involve proposed disciplinary action, but if it does. Step number 3 is the grantee may request to meet with representatives of the co-applicant board to discuss the concerns, which would be scheduled as soon as possible. So we're talking written notice and then the opportunity to meet with the CUC board. Step number 4 is the CUC board reviews the information provided and determines whether any action is necessary or appropriate, and if so, what that action should be. So that number 4 is talking about the CUC board. Okay, all right, then we go on to number 5, where we talk about, we just reiterate that the co-applicant board is responsible for determining appropriate disciplinary action, and that they'll follow the co-applicant agreement and applicable personnel policies that's written into the co-applicant agreement, and that the co-applicant board is responsible for determining disciplinary action and implementing that, okay? The last one, 6, is any circumstance under which, if the co-applicant board fail to act, or to take action that the grantee doesn't agree with as being appropriate, then it comes to our full board, the Central Health full board. And it says that our board, the Central Health Board, can vote to authorize disciplinary action. And it says that only that action can only be taken by our board, and it has to be taken as an agenda item at a public meeting, you know, subject to Open Meetings Act requirements, with specific written notice to the CUC board chair and opportunity for reasonable input from the CUC board. Okay.
So I have, then my further question then becomes, what happens if the converse occurs? What happens if the CUC board believes that our Central Health CEO has overstepped their authority, and where does that come into play? Because I think that's equally important.
Okay, that is a couple of things on that. Okay, that's not the subject. That's not the subject of this. But let me just—it's not within the scope of what we're talking about here. Okay, but it's so that's something our board can talk about how we could ask them to notify us if that's the case. Because the CUC board doesn't have any authority over our CEO. That's our responsibility.
No, but I guess what
you're
I'm
just wanting to know notice from them.
No. I guess what I want to make sure that there's some kind of a notice, because we're not going to know. And
Sure.
as historically has proven to be the very case, we did not know what was going on before. And I want to make sure that this doesn't happen again.
Okay.
So I would assume that we would need to have some kind of language in place or a process in place to make sure that there was a way to inform us. I don't know if I make any sense.
So Cynthia, so what you're getting at is if the CUC board is aware of something that they want to let us know about our CEO. That's what you're asking about.
Yes.
Okay. Well, we'll talk to them about that, and that can come back to us. It's not the
I
scope.
appreciate that.
It's not the
Okay,
scope
I
of
get
what
it.
we're talking about today.
No
Okay?
problem.
Okay. All right. Got it. Any other questions? No? All right. I'm going to go ahead. Oh, wait. Is that a question, Shannon?
Yes, I'll just make a comment.
Okay.
Are we voting on this today?
Yes.
Okay. I'll be honest, I will probably abstain from voting on this. And the reason I'm going to abstain is because I think this is a very complicated, somewhat convoluted process because of the systems that we have in place. Has nothing to do with individuals or something. I just fundamentally disagree with the way this structure is. Two boards.
You mean? Oh, I got you. Yeah.
Two boards basically having equal responsibility at some time, but then ultimately,
Yeah.
one board ultimately is responsible. I think that is too confusing at this point. I don't think we can resolve it by now, so therefore I will abstain on.
Okay. Yeah, you and I have talked about.
Yes.
And we all have talked about the complications of HRSA's, the federal law and the public entity model.
Right.
Which is what we have, and that's our legacy, and that's why we have an FQHC. So, but I understand that you've always had some concerns about that model in the first place.
Yeah.
Okay.
So I just wanted to voice that.
Okay. Did anybody else, Maram, did you have your hands up? Okay.
Yes, thank you, Chair. I just want to confirm while we have the CUC Chair here, Guy, that he is fine with this agreement, and if he can verbally state it to us for reassurance that we're all in agreement, I would appreciate it. Thank you.
Okay, Guy?
I appreciate that too. Yes, I am fine with this.
Okay, thank you, Guy. Okay. Not seeing any other questions? All in favor? 1, 2, 3, 4, 5. Okay, the motion passes. Thank you all. And we have an abstention from, right? Is that right? We have an abstention from Manager Jones. Okay. Okay, managers, we're now going to go on to the next item, which is, we're going to go into executive session. So let me read items 2 and 3. Let's see, I need to read them first, right, David? Okay. Item number 2, and we're going to take these, well, I'll tell you all that in a minute. Item number 2 is receive and discuss a presentation regarding a future state central health system organizational chart and high-level integrated system concept. And item number 3 is receive an update on Central Health Cancer Care initiatives. Let's see. I announced the board is convening in closed session to discuss agenda item number 2 under Texas Government Code Section 551.071, consultation with attorney. Texas Government Code Section 551.074, personnel matters, and Texas Government Code Section 551.085, governing board of certain providers of healthcare services. And agenda item number 3, under Texas Government Government Code Section 551.072, deliberation regarding real property. So we are going to now close out of this and, the time, it's April 9th. The time is 3:24, and we're going out of open session, and we're going to go into closed session. So, okay. It is April 9th. The time is 5:35, and we're entering open session. Managers, we're on our last item, which is item number 4. To confirm the next regular board meeting date, time, and location, which is scheduled for Wednesday, April 23rd at 4 p.m. at the Central Health Headquarters. At this time, I'm ready to accept a motion for adjournment from Manager Valadez, seconded by Manager May. All in favor?
Aye.
Okay, meeting's adjourned. Thank you all.